Welcome back, Psych Dude family. It is good seeing each and every one of you today. If you're new to my channel, let me introduce myself. I'm the Psych Dude, a board-certified psychiatric mental health nurse practitioner. And in this channel, I go over several topics related to lifestyle, nursing, mental health, and I don't know. But if you like if you like my video, please click subscribe. Bye.
Welcome back, Psych Dude family. It's good seeing each and every one of you guys today. So guys, we are having a special video today. I know my wife earlier promised you guys that we're gonna do a Q&A together, and we figured out why not do it now. And yeah, so let's get started on this video. And also guys, if you haven't already, make sure you subscribe to my channel, make sure you give this video a big thumbs up, and follow me on Instagram at THEPSYCHDUDE. So without further ado, let's get through these questions.
Okay, first question. I know Psych NPs play a huge role in medication management, but what about psychotherapy? Do they provide psychotherapy at all, part of med sessions, separate from med sessions? And how much of your practice is dedicated to psychotherapy, if any? And how did your schooling prepare you for that?
So a huge component of what we do obviously is the medication management side, but we definitely do provide psychotherapy, but it just depends on what you were trained in during school. Another thing to consider is where you actually want to work. So a lot of the times, especially when you're providing psychotherapy, is going to be in the outpatient setting. Depending on where you work, that's where you can primarily be able to provide that therapy. But on the other hand, just because there's such an abundance of therapists out there, a lot of the times what we do is provide a medication management side. I'm not saying all people are all like that, but a lot of the times we're going to be doing that. So it just depends on what you do. So a lot of practices, especially in bigger outpatient settings, they do have the designated psychologists, therapists, social workers just for therapy, and then they have psychiatrists, PAs, and nurse practitioners that do provide the medication management. But a lot of the standalone therapy or standalone private practices that have just Psych NPs, a lot of the times they can be able to provide both psychotherapy. So it honestly just depends on where you work. You can provide a lot of psychotherapy, and there's some instances where you can provide very little psychotherapy, and a lot of it might just be that supportive therapy. And honestly, it just depends on what you put forth into it. And also, in terms of what we learn in school, yes, we do have dedicated classes towards therapy, but still the biggest component that we do learn is about medication management and being able to handle that, just because there are shortages, or there is a shortage. So a lot of it is going to be based around that, and a lot of it is being able to pretty much what you want to be putting into the therapy sessions and what you want to be putting into in terms of what you want to learn through therapy. So to answer your question overall, there's a lot of medication management, there's very little psychotherapy component within school. It just depends on how much effort you want to put into learning it. And then also in the outpatient setting, if it depends on which setting in the outpatient setting you work in. Typically, if you're just in your own practice, then you get to decide on how much psychotherapy is, how much psychotherapy you want to do, and then, but if you're working for other people, typically they'll just want you to do medication management with some supportive therapy here and there. I hope that kind of answers your questions. Alrighty, so second question is, you're an L&D nurse transitioning to psych. Do you have psych experience, and do you think it's necessary? My background is in all pediatrics, but I love psychology.
Okay, so I do have experience in psych. I worked in an inpatient psych hospital for about a year prior to moving to labor and delivery. I do think that you should have psych experience prior to going into it, just because like there's so much negativity with psych, and it could be too much for some people to handle. So I'm not saying that applies to everyone, but before you dip into something lifelong, you should be able to see if it's something that you're going to be okay with in the long run. So I just don't want someone to go through all the schooling and then realize that it's too much for them to handle, for them to, even like for some people, I know that like they're so scared of psych, like when they find out you work in psych. So if it's something that you're afraid of, why are you going into without experiencing it first? So I think that's the only, not necessarily everyone needs psych experience, but just I don't want someone to go through all that schooling and then decide it's not for them.
I agree, 100%.
Next question. For NP Psych School, do you recommend an iPad for reading, note-taking, looking up clinical information, etc.?
So for me, I actually just used my laptop for a lot of the things. I had a lot of ebooks, so I was able to read my books on my laptop. But that doesn't say it would be beneficial to have an iPad to do that, because there's so many different apps out there now that kind of allow you the opportunity to do more than what's on your laptop. The reason why I use the laptop is just because if I needed to control find something, it's a lot easier. Especially when you're talking to a patient and not necessarily knowing exactly what they're talking about. So if you can try to control find something a lot faster, then it's more beneficial, especially as a new grad or even a student, because let's face it, we don't learn every single thing in school. But if you're able to have accessibility to that, especially when talking to patients, or even if you're shadowing and being able to look at it while you're with the patient, then it's beneficial. I know you can do that on the iPad, but I don't think many people are as fast, but who knows? If you are good at it, if you're able to find things and you're able to read things and still take notes on an iPad a lot faster than a laptop, then by all means I would do it. But if you feel like, okay, maybe I can type faster and search for things faster, it's a lot easier to use the laptop, maybe just stick to the laptop. But either way, it's gonna work. I think it's beneficial depending on how you use it and how it is for you. Hope that kind of answers that.
Okay, next question. I'm gonna give this to him. It's, what resources do you recommend for the Psych NP certification exam?
So the resources that I use personally, I know it's a new exam, but it kind of has extremely similar components to it. I use the Purple Book. So if you're not familiar with the Purple Book, just search on it and then you'll see it's the ANA Psych NP Purple Book. I use that a lot just because a lot of the roles, development, and policies, those things are in that book, and that's what a lot of my exam was on. I know it kind of transitioned into the professional role, so it's one of those things where you kind of have to focus on that. But for the most part, the Purple Book, I also use the ANA questions. So it's a list of questions, because those questions I think personally are extremely similar to the questions that you do see on the exam. So I would say use that. And then also I forgot what the app is called. What's the app called? It's like one of these apps where you're able to just take questions and just, you can do it anywhere. I'll put the name of it probably around here, but I used that in order for me just to take questions whenever I was working, because at the time I was working as an RN, so whenever I had free time, I would just look on my phone and just do questions as I go along. Other resources, I use Barkley also. I think Barkley helped a lot, and not as much as the Purple Book or the questions, but Barkley kind of filled in the gaps in terms of if I didn't necessarily know what I was looking at or what I was studying, then I could just resort to that and figure out from there. So yeah, use those things. And we are coming out with an exam review soon, so stay tuned for that. Alrighty, so this question is for her, is what are your future plans as Psych NP?
Well, I'm still kind of like in clinical, so I'm just kind of trying to see what kind of settings I like, which populations I want to work with. So I'm just going to let myself just experience this next semester and just see if I find where I would like to work in the future. In terms of him, what is your plans?
Oh,
you have too many.
So many plans. Well, right now I'm in the middle of actually opening up a practice. We're setting up the logistics. We're making sure everything's correct the first time, but I think what I like the most is the outpatient setting. A lot of it is just because you guys get to communicate with patients on a different level, and compared to like urgent care or even telepsych, I think the outpatient setting kind of suits me just because you get to sit down, have a conversation, and just be able to see the whole process of the healing process for the patient. You get to see them from the very beginning when you do have that initial psychiatric evaluation. You get to see which different steps you take in order for them to get better, and then in the long run you're going to see the outcomes, and hopefully they can kind of graduate from you. If not, then you kind of can see their life, their whole life, just because a huge thing for me is just being able to communicate and being able to just talk to people, because I love talking, as you can already tell. So I'm able to do that in the outpatient setting. And yeah, just opening up my practice, possibly teaming up with my bros in terms of actually setting up Mental Wealth Nation in the review course. Too. And the girl too, she's a bro too, so that's cool. And then also, yeah, who knows what's out there. I'm definitely doing research. If you have any ideas or anything like that, comment down below so we can team up, see what we can do. But for the most part, I think I want to focus on private practice, outpatient settings, and then dabble here and there in terms of telepsych and urgent care.